The key messages of the paper is that racism in its various forms, in particular systemic racism, is a fundamental cause and driver of ill health amongst ethnic minorities. And COVID-19 is just the latest example. Research also shows that even if you account for social determinants of health and socioeconomic status, there is a striking persistence of ethnic differences, inequities, and disparities between ethnic minority groups and communities and white majority populations. And I think based on these findings, it's very important to emphasize that the first major thing that must happen is a recognition and acknowledgement that racism is at the root causes of all these disparities. That is why we recommend that ethnic minorities, there are two immediate things that must happen to protect ethnic minority communities from the exposure to an acquisition of COVID-19. And that includes placing ethnicity in the extremely vulnerable category where the risk is high, ensuring that there is a comprehensive, meaningful risk assessment that takes into account people's risk of exposure, occupational risks, and their pre-existing conditions, age, gender. All these things are quite significant. A lot of low-paid ethnic minority people are working in environments where the risk of exposure is very high, because most of them are in patient-facing roles, public-facing roles, and they do not have, because of the low socioeconomic status, low-paid jobs, they don't have the luxury of working from home and so on. So that is very important. When you place them in the extremely vulnerable category, everything else will follow from that. All the measures, including vaccination, priority for vaccination, absolutely.
Prime Minister.
Yes.
You're all right, Andy.
Okay.
Well done.
The most important thing is to recognize that racism is at the root cause of the ethnic disparities, and particularly systemic racism. And there is a lot of evidence on how we can go about mitigating the effects of systemic racism. And the time has come now, and COVID has highlighted once again these disparities, and we must act now.
How are you doing this morning?
I'm good.
Okay.
Hi.
Here we go.
In fairness, that was great.